Tonight on Chronicle.
6 days before my 40th birthday, I had a heart attack.
It's a staggering statistic. 1 of every 2 women will die of heart disease.
You know, some of us women today as caregivers, we're thinking about our children, you know, having a runny nose and they have a cold, but we're not taking the time to listen to our bodies.
What you can do to check your heart's health.
If you're a woman and you think you don't have to pay attention because it's a man issue, you're wrong, possibly dead wrong. Because 1 of every 2 women will die of heart disease. And in fact, it's the leading cause of death in women over 35. But you know, it really doesn't have to be.
And tonight, our pal Jennifer Crompton is paying a visit to Portsmouth Regional Hospital for a look at a phenomenon we all may think we know enough about, but do we?
Toril Kawisan was buckling her youngest daughter into the car when her arm pain and nausea became too severe to ignore. Her husband Kevin insisted he take her to the emergency room at Portsmouth Hospital.
So 6 days before my 40th birthday, I had a heart attack.
It came without warning. She has a very healthy lifestyle, and only a grandmother who had survived a stroke hinted at any family history. She feels incredibly lucky it happened as it did, because in the cardiac world, time is muscle.
If my husband had not been there, I would have ignored the symptoms, and I would have gone to work and carried on my day as usual and maybe found some way to deal with the pain on a temporary basis, doing irreversible damage to my heart.
42-year-old Kathy Teagland has a renewed respect for life. She was being treated for high cholesterol that ran in her family, but when she felt uncomfortable pressure on her neck, she waited 5 days to get help.
They discovered that I had an aneurysm just outside of my heart. And they came and told me I was going to need open heart surgery. And I was floored. I think I saw my life flash before me. I thought of my husband and my young son. And I thought, I've got to do whatever it takes to make it through this. I'm just too young for this.
Polly Barnes works at the hospital, but was in denial.
And I thought I was just overtired because of post-holiday season, a little stress. We all work so hard, everybody, especially women who are handling different areas of their life, grandchildren working full-time, husbands that need tender, loving care. And it happened.
All right, Dennis, it's going to pick up here, faster and steeper.
Awareness that heart disease is not just a worry for middle-aged men has been an uphill battle. In fact, women with cardiac issues are more likely to die of them. Part of the problem is they don't necessarily have typical symptoms like chest pain.
They'll present with fatigue. They're pale, they don't look right. They're noticed, a family member or a relative will say, you just don't look right. Diaphoresis or sweating, another major complaint, nausea. So constitutional symptoms which could be associated with any flu-like symptom.
Advances in technology are saving lives. Having a stress echocardiogram is one of the modern diagnostic tests for people who are at higher risk, allowing cardiologists to see a 3-dimensional view of a patient's live beating heart. And if an event does occur, intervention can include opening blockages with procedures in one of Portsmouth Hospital's state-of-the-art cath labs.
Within, what felt like 90 seconds, there were 10 people in the room preparing me for the cath lab, and 45 minutes later I had 3 stents put in.
These stents frequently, and the ones we commonly use, are embedded with antibiotics that reduce the inflammation within the artery and reduce the renarrowing.
So in other words, the finger
you actually have
veins,
you have the picture of an acute myocardial infarction right there.
That's a heart attack.
That's what it is. A vessel which was open and it's not. There's a clot there that has formed.
Dr. Sisto is chief of cardiothoracic surgery at Portsmouth Hospital, where technological advances like the Impella catheter have dramatically improved survival rates for the sickest heart patients. But awareness of things like family history is still key.
There is a simple statement that will focus and will tell you how dramatic heart disease is. And it is 4 out of 10 people is the first manifestation of heart problem will literally drop dead.
The good news is that for most people, prevention is possible, and information like blood pressure is their fiercest ally.
Typically, for example, when I see patients that I have to do surgery on and they're young, one of the first things that I ask them literally, what is your cholesterol level? What is your bad cholesterol, good cholesterol? And if they don't know, I kind of get upset because I said, you know, it's in your power to know it, and if you know it, you can do something about it.
But you know your numbers?
Oh yes, I absolutely do know my numbers. Absolutely, yeah, they're great.
Lori's co-worker had a routine EKG on this day, both women taking advantage of screenings offered through WOKQ and the Shark. Sheila was especially curious because she has a family history of heart disease.
46, mom, wife, work hard, stressed all the time. So when offered this opportunity with Portsmouth Hospital to come in and do what we're doing, I said absolutely, because it's one more thing that if I don't have to think about it or worry about it, I can move on.
You know, some of us women today as caregivers, we're thinking about our children, you know, having a runny nose and they have a cold, but we're not taking the time to listen to our bodies.
If I could just reach one woman out there and tell her she needs to take care of herself, prevention is the best. Prevention. Quit smoking. And if I have to say one thing, it would be my heart, from my heart to yours. Take care of your heart.
6 weeks after my heart attack, I had my stress tests. And then shortly after that, I had an appointment with my doctor, Dr. D. And he handed me the results of the stress test just to look at my reaction, and my heart function was back to normal. That was a pretty powerful moment.